us to live. It's going to have a little bit of lag, and I'll tell you when we're live. Three, two, one, and welcome. We are live here on Facebook Live. I'm here with Dr. James Leiber, the founder of our practice, and I'm super glad to welcome him back to we're going to call it a podcast or whatever we want to call it for now for Regenexx Tampa Bay. So Dr. Leiber, thanks for coming back.
Hey, thanks, Dr. Torrance. I think you're doing a great job with these Facebook Lives. It's good to be able to speak directly to people who are listening and try and provide some educational information and answer some questions.
Well, fantastic. Well, I just want to keep you in the loop of what I've been doing during these. So what I do is I keep the actual stream up here on my phone. So if I get any questions or anything, they populate for me. But I want to engage with my audience, but I also want to engage with you and really discuss today. I want to talk about Regenexx Tampa Bay and Regenexx and what is that? And if you want to expand on that and let people know what Regenexx stands for.
Yeah, I mean, let me spend a few minutes, if it's okay with you, just talking about the philosophy behind what we do and the science. Of course, we'll get into that too. But philosophically, I mean, Regenexx is basically an alternative, a orthopedic surgical and pain treatment alternative that up until recent years was not available, and certainly not at the skill and with the technology available that today that wasn't available previously. So Regenexx is that alternative for surgical and pain treatments, basically.
Mm-hmm. Okay, and so how did you, I think we talked about this briefly before, but you got involved really back in 2011. Is that a time frame, or when did you start with the Regenexx?
Well, yeah, with Regenexx, we started the conversation in 2011 and signed a contract in 2012. But before that, I was doing similar types of procedures for a few years, and even before that, we were doing kind of the grandfather concept, with which I talked a little bit about before on your show here or your Facebook Live, doing prolotherapy, which is a similar type of concept. So I've been doing this a long time now, and it's really evolved in a lot of different ways. Let me just kind of, if it's okay, just explain a few things. So if you're in pain, right? If you wake and as you get older, and as I'm getting older, there's always a new pain that kind of surfaces, and in your mind you wonder, is this pain going to go away, or is this one of those things that's going to be here for 4 or 5 days, or is this going to be lingering for months and not knowing whether it's going to ever go away? So when you first get some type of a pain condition, whether it's from an injury or just chronically, you just wake up with it, or you injure yourself doing something minor, what do you do about it? First thing you do is you just take it easy for a few days. Maybe you ice it. Maybe if it's not getting any better, you take some sort of over-the-counter medication like a Motrin or a Tylenol, or some type of an anti-inflammatory supplement. You stretch. Maybe you'll see a physical therapist if you get that ordered for you. Your physician, if you're unlucky, will offer you a steroid, a cortisone injection. And then what if that's not getting better? Maybe you'll engage with an acupuncturist or chiropractor. See, there's a lot of these different kind of non-surgical sort of options that are available, non-invasive type of things, and laser treatments and traction machines, all these types of things that are out there. But what happens next? What happens if you've tried these things and you're not getting any better? The typical paradigm has been your doctor refers you to a surgeon to do a surgery that we'll talk about here that oftentimes is got very little evidence to support it, or may have bad outcomes, or may make things worse in the long run, in the sense that it may make you more likely to have a more major surgery down the line. So there's been a big gap between this kind of conservative care and this surgical model. And in between, it started to get filled with physicians who started getting more expert in injection procedures. And the technology for being able to do injections, that is to get a needle somewhere safely and accurately using some type of image guidance, like live x-ray or live ultrasound, that's gotten better and better, and people have gotten more and more skilled at doing that. Unfortunately, what most physicians have done have used cortisone to inject something to try and decrease pain. And we can talk more about it, but there are some significant issues associated with using cortisone. Or what's frequently done and covered by much of the insurance world is things like radiofrequency ablation, which is burning of nerves, implantation of neurostimulators in the spine. These are things that have been placed in the realm of non-surgical, but really aren't the best model in our opinion. We think we can strengthen tissue with a variety of different techniques that we can talk about. So this whole field of placing a needle somewhere to strengthen tissue to reduce pain, we call interventional orthopedics or interventional regenerative orthopedics. And, I guess it's important to think about, and, you and I can talk about this here. What are the things that we're treating so people understand what it is we're trying to get at here? I mean, Dr. Torrance, on a given day, what sorts of conditions are you treating?
Yeah, so I just want to kind of rehash exactly what you just talked about so that everybody can see it written down and see it written out. So he's talking about pain and, whether it goes away at the first 4 to 5 days, whether you're using conservative over-the-counter meds, PT, chiro, acupuncture, laser, traction, and then cortisone. And if you didn't get relief, really, you were left kind of hanging to either go to surgery or just kind of live in pain.
Or narcotics, right? Or narcotics were another one that fills that gap.
Exactly. And they fills the gap. So no relief, you either go to surgery or, worse, you go to narcotics. And that has created the opioid epidemic. And what really orthobiologics or interventional orthopedics has really come to fill in is that gap and trying to get people out of pain in a more in an interventional way, but less interventional than surgery. And your question was, I just want to kind of bring it back to everybody so everybody can see it right now and kind of give yourself a little where that comes in. So we kind of insert ourselves into this area before surgery and try to get rid of narcotics. And what it is I see people all the time, whether it be a meniscus tear or a small rotator cuff tear. Now that patient would be told that lots of times they would need an orthopedic surgery or an arthroscopic shoulder rotator cuff repair or a labrum repair. Now, we have really the PRP, platelet-rich plasma, for a tendinitis, has fantastic results. We've seen time and time again that's going to work. I feel, and I believe Dr. Leiber would agree with me on that's going to work, 9 times out of 10 for most patients. Now, nothing's infallible. I definitely think that, 9 out of 10 patients will get relief from that. And those are the patients that I see that we really fill that gap.
Yeah, I mean, I think we can even expand on that a bit. I mean, it's with time and experience here, I've been able to find that even severe conditions that normally you would think of as having no other choice, in some cases, things like very advanced arthritis of a knee or a shoulder, or you mentioned a small rotator cuff tear, but even large rotator cuff tears or large ligament tears, we're finding that we're getting very good clinical results in these patients. And that's kind of what I want to expand upon is how do we know that? How do we know that we're getting these results? Is it just me saying my experience shows this? Well, yeah, I mean, that's part of it. But the other part is we aligned ourselves with a national organization, Regenexx, who founded the concept of doing these injection procedures with bone marrow, stem cells, or with platelets in this country. And from the very beginning, did this the right way. That is, obtain the data. You can't say anything without data. You can't sit in front of a patient and say you are a good candidate, a bad candidate, a fair candidate. You can't say those things without having something to back that up. And so Regenexx has been able to collect the largest database registry in the entire world on these procedures. With over 180,000, I think, procedures at this point that have been performed across the country. It's a lot. And with the registry data, we're able to look at our own outcomes. We can look at our outcomes in comparison to other Regenexx clinics across the country, and we can give patients realistic expectations when it comes to these procedures. And what Regenexx Corporate has been able to identify, working with self-funded employers, which I can discuss here in a few moments, is that 70% of all orthopedic surgeries are probably preventable and treatable with something that's cheaper, safer, it gets people back to work sooner, and without causing any further harm. This is a real field with some really positive outcomes currently, and with a great future. We have a little bit of a problem in the field that there's a lot of opportunists and people who are trying to take advantage of the population and trying to fly under the radar of the FDA, but doing things that are not considered to be compliant with FDA regulations and getting away with it right now. And I think a self-funded employer is looking to add Regenexx as a program for their employees. Needs to understand that working with Regenexx is very different than working with a chiropractor down the street who's recommending some type of a fake umbilical stem cell procedure. Yeah. But I wanted to talk a little bit more about, what is it that what are we injecting? What kind of materials are we injecting? Now that we can see that we can get a needle pretty much anywhere within the body, musculoskeletal wise, safely, in a disc, in the spine, around a nerve, a pinched nerve in the back, as you mentioned, rotator cuff, labrum in the shoulder, same thing in the hip and the knees, ankles, wrists, elbows. Those are the things that we're treating on a day-to-day basis. What do we want to do? We want to put some type of material there that's going to increase the strength, that's going to heal something that may be torn potentially, that will decrease the inflammation, that will improve the health of that tissue. And we're obtaining that material from the safest source we can get it from, and that is the person who's in front of us. Yes. So the person who's in front of us, we're able to get blood products, concentrated platelets, which have these things called growth factors, which are shown to heal. We can get stuff from the blood called A2M, which is a material that decreases inflammation pretty significantly in arthritic conditions. And then we are also able to get bone marrow, which we're able to isolate certain layers of the bone marrow that contain higher concentrations of stem cells, and utilize that in conjunction with platelets for trying to heal tissue. Or even in some cases, in a compliant way, we're able to use fat or adipose tissue from a person to try and decrease inflammation or add cushion or support to an area. So overall, what I'm getting at is we get the material from that person, we process it in a laboratory with very sophisticated techniques, and then that then becomes a liquid that we use to place precise injections into various different tissues after we've made that assessment with the patient during the initial consultations. So, the keys here that I think I want to summarize are the material comes from that person. That is the safest source. We also have good data to show that's effective. We are placing the material safely and accurately using image guidance. And that's really a lot of times where the rubber meets the road. A lot of people are lacking in the skill sets to be able to do these procedures, to use live x-ray or live ultrasound. That really takes a heck of a lot of skill. And a lot of the things we're injecting were never injected before, so they weren't traditionally taught in schools or residencies. And we are the ones who are involved in helping instruct and teach the rest of the country how to do these procedures. So I think they're kind of neat. We have excellent videos to show how some of these things are done, but we're able to place this material in a safe way. So what I think of is, what is the need in the country? Is there a need for this? We started off talking about the gap, that sort of gap. Mm-hmm. I think it's a little bit mind-boggling to think that there are about 126 million people in this country who've had pain in the last 3 months, right? That's a lot of people, and 40 million of those people have had pain every single day for the last 3 months. Yep. And about 20 million of those have had pain daily for the last 3 months, to the extent where it's impacting their ability to work or even function in their daily activities. That's a lot of people. So we know that there is a need here for better solutions. And I think if you think about the strategy here, what we're talking about is I like to call it a tissue preservation strategy. We're trying to keep people's tissue. We don't want things to be cut, to be snipped, to be removed, to be sewn. What we're trying to do is try and heal and strengthen using somebody's own materials. and doing this under highly skilled injections. We want to avoid harm because most of what we've been doing as a profession can be considered to be harmful for a large percentage of people receiving these treatments. That is, cortisone has significant issues associated with it, and then things like anti-inflammatory drugs. And even though they're sold over the counter, have been shown to have significant issues associated with it, which I won't get into here, but there's a lot. And then, of course, unnecessary surgeries and excessive use of narcotics and the epidemic and the drug overdose deaths that we started to talk about earlier. So we're trying to facilitate healing, avoid harm, preserve tissue, and do this under precise placement. I don't know if you know this fact, but in 2018, Regenexx rejected, I think it was 94% of the applicants into the network. So just to become part of Regenexx, you have to, first of all, be a musculoskeletal expert to begin with. You have to then have passed and taken certain other types of training and proven that you've done certain numbers of injections using these various precise imaging guidance techniques. And even then, more than 90% of those who are applying are getting rejected. It's a very, very selective network of doctors who are doing extremely high-skilled procedures. So, I'll pause there if you have any questions, but then I can go into, I think I want to talk a little bit about the insurance aspect.
Absolutely. So let me just kind of bring everything home here for you. I wrote it up on the board here while you're talking about it, just so we can kind of make sure anybody's more of a visual learner can kind of get an idea of what we're talking about. There's a lot of people who are audible learners, who are visual learners. I am a visual learner, so I like writing it down because it makes it really resonate with me a little bit better. So we're talking about, what makes Regenexx different and the areas of the body we treat. So shoulder, knee, spine, lumbar, thoracic, cervical, foot, ankle, hand, wrist, and hip. And, in that requiem, we've done over 108,000 procedures collectively as a group. And utilizing a registry, we've seen that platelet-rich plasma, bone marrow aspirate concentrate, MFAT, A2M, and platelet lysate, something that we didn't really discuss, but that's something that definitely helps with nerves. You may have mentioned it, but I didn't write it down. But these are all coming from your own body, number one. So anybody who's concerned about really somebody getting cells from somebody else, all those kind of things, we specialize and we really try to utilize your cells from your own body. And then we utilize ultrasound and fluoroscopic guidance to make sure that, and we have a selective network that over 94% of people, 94% of candidates or people who wanted to join the Regenexx network were rejected in 2018. So you can tell that Regenexx is going to give you, number one, quality product, like the Starbucks of the regenerative medicine field. You know that you're going to get a quality product by coming to Regenexx, a quality physician that has been thoroughly vetted and make sure that everything is going to be really top notch. And then, and we treat all these areas. Now we have, and what has Regenexx done with this, and that's what Dr. Leiber's about to talk about, is the self-funded insurance network and how we've utilized these 108,000 procedures and the registry with the outcomes data to really help make this more affordable or accessible for more people. Does that sound about right?
Yeah. So I think a lot of patients will say things like, if this is so effective, how come insurance doesn't cover it? I think we hear that on a regular basis, and that's a good question. I think it's a valid question, and it's just need to have a little bit of an understanding of how the insurance world works and how things get approved and what's involved in that. And obviously, data is necessary to prove sufficient amount of effectiveness and cost effectiveness before an insurance plan will start thinking about adding it as a covered benefit. It's got to be safe. It's got to be cost effective. It's got to be clinically effective.
Can I jump in there for a second, Dr. Leiber?
Yeah, sure.
I think that people right now with the COVID-19 crisis are seeing really what needs to be done for things to get covered by insurance. I think that this is actually a very interesting time for people to really see kind of the processes that are in place so that insurance coverage or something gets proven and actually allowed to be done. Would you agree with me on that? Yeah,
absolutely. I think that's true. And, something that's interesting is the self-funded world, the self-funded, self-insured companies. This is something that I was not very familiar with until just a few years ago. I had already been in Regenexx for quite a number of years within the network, and was still not familiar with this until, I don't even know, but it's been several years now. But the point being, about 100 million, I think it is, or it's a pretty significant portion of the working population is funded through a company that is what's called self-insured or self-funded. That is, they are internally funding the insurance plan, and they may hire a third-party administrator or an insurance company to sort of administer the plan, but they have a lot more flexibility in making decisions and implementing and adding innovative type of programs into their plan as a covered benefit for their employees. And so Regenexx decided a number of years ago to start working with some of these companies, and was able to, fortunately, at the early onset, get a couple of Fortune 500 companies on board. And with that, they were able to collect a fair amount of data that's important to other companies. So that is things related to how cost effective is this procedure, the procedures we do with Regenexx in comparison to doing a surgical procedure as for the same condition. And what they've been able to find is that it's significantly cost effective. It's clinically very effective, and they're saving insurers, these insurance plans, the self-insured companies, maybe 70, 80% of what they would normally be spending. And when you survey the people who've had these procedures and ask them, the employees, whether you would choose to do a Regenexx procedure or would you have a surgery for the condition that you've had treated, it's a no-brainer. 95% of them would choose to have a Regenexx procedure. So for a self-insured company, to result in cost savings, quicker return of employees, effective treatments, it seems like an important thing that should be considered by these companies. So what we have now is at least 6 million people in this country. That's 6 million people already covered to have Regenexx procedures. That's not any orthobiologic or regenerative procedure. That's specifically with a Regenexx doctor. One of the things that the companies, that's important to these companies, is that especially if they're based across the country, that their employees in Texas can go to, or their employees in New York or in Florida can go to a Regenexx doctor, and they know that they're getting a standardized protocol, an evidence-based protocol that's been vetted, and that is going to be the same no matter where you go. The laboratory techniques, the way we're doing the procedures, and so the quality assurance, all of that is very important to an employer. And we've been able to provide those kind of qualities and characteristics that they're looking for. So a lot of big companies you've heard of, and a whole lot of smaller companies, and even municipalities and counties are involved in offering Regenexx as a covered benefit for their employees. And so I usually give the example to patients in this area that if you work at a Marine Max or certain nursing homes in the area, there are certain McDonald's, there are various smaller companies that you maybe never even heard of before, electrical companies, Dow Electronics is an example, or media companies, even places like Dillard's, which is a very well-known department store. If you work at these companies, then you can get your procedure covered. So to say that these procedures are not covered is just not accurate, but they are being covered in a particular way through these employers. The reason is because they're looking at their bottom line. They can understand that the number one threat to earnings when CFOs are surveyed is healthcare costs, and the number one healthcare costs are orthopedic issues. So for their employees, those orthopedic issues, about 80% of it's covered by workman's comp, and about 15, 20% goes through the health plan. And so orthopedic issues are a massive, massive expense in this country. Almost $1 trillion is being spent on orthopedic issues annually. And so the companies that fund their plans know that they got to figure out a way to get better value out of their health plan. And working with Regenexx has been able to do that for these companies. So I'll pause there for a second if you have any questions, or I can go on with other things.
No, I had one patient. One person jumped on here. Linda, are you back up doing procedures? I gave a thumbs up back. Yes. I just want to make sure that everybody is aware that as of May 4th, Governor DeSantis gave the go-ahead for elective procedures. So we are back open. Something that we want to make sure that everybody is aware of. We are, a max COVID protection zone. That was discussed in the last discussion with Dr. Leiber. And we'll be updating the website within the next week or so with what that looks like at our locations in Tampa, Sarasota, and Miami, our Gold Coast location. If you're on the East Coast or you're down in Naples, don't want to take a short drive, they're back up and going. I got on with Dr. Musman earlier this week. And then one of my patients, that I'm actually treating tomorrow, she says, see you tomorrow. So, we got some, people really love what we do, and that's a self-funded insured person as well. So it's really good that I love that we have this available for patients, and like you said, 95% of the time they're going to choose the Regenexx procedure over orthopedic surgery. It's getting to be about 30 minutes. I have not, I've had a couple people trickle on and off. Do you want to make any last kind of statement or anything? I put in the link, just want to make sure if anybody wants to get a consultation with Dr. Leiber or myself or Dr. Pappas or Dr. Musman in Gold Coast, I put a link in there to fill out a candidacy form, and that could set you up with an appointment, whether that's telehealth or in office. We are seeing patients in office, as I said, through a max COVID protection zone, where a virtual car waiting room. After the car waiting room, and we screen you, and then we take your temperature and pulse ox. You're given an N95 mask. You will come in the office, and then you'll be seen by a doctor wearing a mask and any staff wearing masks. We also have Pico filtration, the molecule air filtration devices in multiple rooms and high areas of flow to make sure that we're making sure that any viral particles that do happen to get past the N95 mask are then caught by the filters. So we're doing every step, and we're testing. We're working on the testing process to get all of our staff tested and make sure that everybody is good and clean. So, Dr. Leiber, you want to make any statements before we call it a night?
No, I think that's important that you brought up the COVID-19 protection. We're a low volume clinic. We don't let more than one person in at a time, and they're highly screened before they walk in the door. We don't see sick people. So there are no sick people who ever come into the clinic, either employees or patients. And then obviously we know that there's some asymptomatic carriers and spread. So we're taking extra precautions and figuring out if there are any clues to that. We won't let that person in the clinic. And then in fact, in case there's an asymptomatic carrier, we're all highly protected, and obviously cleaning excessively, hand sanitizing excessively, using the specialized filtration filters and specialized masks. It's very, very, very low chance of any sort of spread through our facility. So I want to make sure you understand that we take that very, very seriously, and we don't want anyone to be sick. Of course, we want to be here to help you with all your musculoskeletal needs, and appreciate all of your support. And we look forward to meeting you and helping you get back to doing the things that you love to do.
All right, fantastic. Well, we have a schedule kind of starting off that Dr. Pappas is going to be doing Thursdays around 6 o'clock. Dr. Musman does Mondays at noon, and then I'm continuing to do Tuesdays at 6 o'clock. I'll be bringing various different guests on here. Until that time, make sure you wash your hands, keep 6 feet apart, and take good care of yourself. Dr. Leiber, thank you for coming on as always. And
thank you. Don't touch your face. Don't touch your face either.
Don't touch your face. Don't touch your face.
Yeah.
All right. Have a great night. And thanks everybody for popping on, and leave any questions below. I'll field those later. Thank you so much.
Thank you. Appreciate it. Take care. Bye-bye.